This video will explain non-medicinal and surgical options available for plantar fasciitis. Conservative treatment begins with ice, which can be applied to the affected painful area for 20 minutes at a time at intervals of at least an hour. This is the first step to reduce swelling. Orthotics with medial arch support help stabilize the medial longitudinal arch and reduce strain on the plantar fascia. Similarly, proper footwear is necessary for arch support and to prevent the heel from wobbling when it strikes the ground. Both orthotics and footwear are discussed in detail in another video. After appropriate treatment to reduce pain and inflammation, stretching and exercises can be done to reduce symptoms. These techniques can be viewed in our other videos as well. Casting is sometimes used in an attempt to immobilize the foot. This prevents further irritation to the area and allows the degenerated tissue to heal. According to Dr. Daniel Haig, DPM, conservative treatment alone can heal 85 to 90% of plantar fasciitis cases. Since most cases respond to conservative treatment and anti-inflammatory medication, surgery is thought of as a last resort for chronic plantar fasciitis that will not respond to these conservative treatments. The procedure can be an open surgery, where the foot is completely opened up to view the plantar fascia, or a minimally invasive endoscopic procedure where a small scope is used to visualize the area that would otherwise need to be surgically opened wider in order to see. Endoscopic surgery seems to have better outcomes in the published literature. In a study by Falat in 2013, 53 patients with 55 fasciotomies were reviewed. Of the 55 fasciotomies that were performed, 23 were endoscopic and 32 were open. Results of the study showed that there was a greater reduction of pain by the first post-op visit in the group that underwent the endoscopic procedure. After a year, however, there was not a statistically significant difference in the pain levels of the two groups. Additionally, the endoscopic group returned to normal activity after an average of 2.82 weeks faster than the open procedure group. Therefore, the preferred surgical technique is endoscopic plantar fasciectomy to release the fascia. It is also more cosmetically pleasing for the patient as the incision sites are very small. The procedure is usually done in less than 30 minutes if there are no unexpected complications. The procedure starts with appropriate anesthesia. A tourniquet is then positioned to limit blood flow to the area during surgery. A 5 mm vertical incision is then made anterior and inferior to the medial calcaneal tubercle. This site can be determined via radiograph or by direct palpation. A blunt dissection is then performed to the depth of the fascia. A channel is made immediately inferior to the fascia into which a cannula is inserted from medial to lateral. Another 5 mm incision is made on the opposite side of the foot to allow for exit of the cannula. An endoscope is placed in the cannula to allow for visualization of the plantar surface of the fascia on a monitor. When the medial side of the fascia is visible, a retrograde knife is inserted to release the medial aspect of the fascia. The lateral half to 2/3 of the fascia is left intact. Upon completion of the procedure, the cannula is removed and the area is injected with bupivacaine and dexamethasone to produce an extended period of anesthesia and swelling reduction. Sutures are then placed in the medial and lateral aspects of the foot where incisions were made. A compression dressing is applied and the tourniquet is removed. Patients are full weight bearing within 24 hours. Dressings need to be changed after 3 days. The medial suture is removed after approximately 10 days and the lateral after 21 days. After the medial sutures are removed, sneakers can be worn as tolerated. This new break in the fascia allows it to stretch out much more easily than it previously could. Irritation and swelling are reduced and pain subsides.